Put the eye in. Just hold that for a second. Put this back here. Feather out there. See that?
Thank you for having me today. How do I sound there? Is my voice clear?
Yes.
Okay. So my name's Nashlea Brogan, and I live in Sarnia, Ontario. And I'm really excited to be here today to talk about hearing. It's a passion of mine. And what I always talk with people is how hearing care is healthcare. And it's something in society today, in our communities, that we tend to think of hearing care as just a hearing aid. And we don't realize that hearing care is involved in a lot more in our body. And when we talked earlier, someone mentioned about people online using artificial intelligence or Googling and searching. We see that a lot in the clinic. And it's a problem because hearing care is healthcare, it's medical care. And it's always to have good advice and be educated on what's actually happening in the ears, not what we Google online. So I'm a huge advocate of trying to provide accurate information and almost the most latest information to give to you so you know what things have changed in the last couple of years in hearing care. So my story is I went deaf. I was an adult when I was diagnosed with a hearing loss. I had normal hearing growing up. And then I basically was told, you're going to go deaf in the next 20 years. I was fit with hearing aids when I was 18, and they thought it was recessive gene. I was studying psychology in university, and I was obsessed with human behavior. And why do we find it so hard to accept hearing loss? Because I found it really hard. I did not want to wear hearing aids. I did not want to take my audiologist's advice. And I've been under the care of an audiologist for the last 29 years of my life. I've had 2 audiologists who I've seen every 6 to 12 months for the last 29 years. And it's a fascinating journey because we're trying to understand when people start to lose their hearing, like their vision, like anything medical condition, why people struggle with it so much. And I've been treating people for 19 years here in Sarnia. We've treated thousands of people over the years. My team, I have 5 clinicians now who work underneath me. And the power of educating people and the importance of how our brain is involved in hearing. And that's what changed in 2020. In 2020, a huge study came out for the first time ever that basically showed that all the most modifiable risks of getting dementia was treating hearing loss. So when they looked at, there was 39% of factors you can do, diet and exercise, but hearing loss is the #1 thing, more than diet, more than exercise, because hearing stimulates our brain. We hear with our brain. We don't hear with our ears. And that's why we say hearing and cognitive health. People think they're treating their ears. When we treat hearing loss by fitting it with a hearing aid is just a tool in our toolbox that we use. When we treat people's hearing loss, we're stimulating their brain and we're setting the signal properly to make their brain work. And a lot of people don't know that because in the last 40 years in social media, on Google and advertising, they only advertised the tool, the hearing aid. They never talked about what was going on with the brain. Your ear is what picks up sound. It amplifies sound. Your ear is an amplifier. That's all it is, a volume control that goes up and down. But when the ear becomes damaged, it's the signal to the brain that is broken. And it's your brain that understands language. It's your brain that helps you hear in background noise. When you go into a noisy room, it's not your ears. It's your brain's ability to say, I need to hear that person, and I got to filter out the background noise. It's your brain that helps you hear accents. And it's your brain why when you're watching Downton Abbey or someone has a British accent and you're struggling to hear, that's not your hearing, that's your brain. And that's why treating hearing loss is so complicated. And that's why now we talk about hearing and cognitive health, because since 2020, with this landmark worldwide study, Harvard Health, Mayo Clinic, every major, they publish every week on it now, is that we still treat the hearing loss, but now we're talking about cognitive health. And I love the example to give to people is we've always compared hearing to vision, and that was the wrong comparison because there's actually very little comparison between what we do with eyes and ears. They're just 2 different systems. But if you were to go have knee surgery tomorrow and you get a knee brace afterwards, would you go have knee surgery or hip surgery and skip the physiotherapy? when you have a hearing loss and you treat your hearing loss, the hearing aid's like the knee brace, but it's the physiotherapy, the brain exercises, the routine that happens in the 6 to 12 months afterwards, where we're trying to get the brain hearing and background noise, we're trying to get the brain understanding accents again. So your hearing health is cognitive health. And when people understand that, they understand that trying to hear better is a lot more than just buying something and plopping it on your ear. And I know that sounds horrible, but that's what society thinks about hearing treatment. So today we talk a lot more about how your brain is hearing, and then we're looking at all the other health conditions that are related to it. So for example, we know that diabetics are twice as more likely to have a hearing loss. We see people with heart disease because when you have heart problems, it damages the small blood vessels in the ear, and we see it in the clinic all the time on the test results. We see the risk of falls goes up when a person has a hearing loss because your balance system is inside your ear. And how we know what direction sound's coming from is by our ears. And then on top of it, our memory is tied to our hearing. So when a person starts having difficulties hearing and they're going to background noise, what's happening is they go to a noisy restaurant and they're trying to hear 2 and 3 people talking and it's really noisy. It's their brain, the auditory memory, not being able to remember what's said, because it's like the ears are working too hard, the brain is working too hard, and they can't understand in background noise. So the exciting thing is that in the last couple of years, the advancements in hearing healthcare is now in our clinic, and when people come in, like Alan came in for a hearing assessment, for my first 15 years, people would come in and they would come in for a hearing test. And, we didn't ask them about diabetes. We didn't talk about the risk of falls. We didn't talk about heart disease. We did some beeps in the booth. We tested 1 words if everyone's has anybody here had a hearing test before? Just 1 word at a time, right? And that was a standard. In North America right now, only 20% of hearing clinics test speech and noise. We test speech and noise in everybody now. So every single person who comes in has a hearing test, we run them through sentences in background noise, because that's the #1 reason why people come in to seek hearing help. But we're not just trying to figure out why they're not hearing in background noise. We're trying to figure out what that's doing to their brain. So now the cognitive health part comes in, is that we're doing cognitive screening, which is what Alan had, is that we do the cognitive screening. It's a measure that tests your auditory memory, how fast you're processing sound. We're testing your executive function, which is how your brain can separate speech and background noise with your auditory memory, and then how quickly you're remembering it. So people come in now, we're asking more memory questions than we are hearing questions. And the results have been amazing, is that people now, because what happened before, someone will come in and we would just treating hearing loss with a hearing device. Now we're talking about what medical conditions do you have? How can we help improve your memory? And how can we help improve how you hear in background noise? So the hearing health, cognitive health connection is basically, how is your brain remembering and how are you hearing? Now, when people come in, and there are a lot of times they don't have the correct information, and the focus is so much on the device, not making themselves hear better. And that's what we're trying to change. We're trying to change what we call your journey with hearing loss, because my journey was, I was lucky. I had a phenomenal audiologist. Like, she's just one of, I think, the most phenomenal in Canada. And she really forced me to work hard at hearing better and work. So I got lucky in terms of the first person who helped me. But I still went through all the emotions of not wanting it, being frustrated in background noise. And now with more education and training, we've seen a whole change in the field where people are, once we start focusing on how a person's brain is processing sound and how they're hearing, they're doing just so much better with the technology. Now, does anybody know anything about hearing, does anybody in this room have any experience with hearing devices? And has anybody been frustrated with in background noise or the aftercare you receive? Now, when you've gone back for aftercare, is there any certain types of questions you've ever asked somebody to when you went back? Did you ever ask how can I hear better in background noise, or did you have those questions answered?
I've always been told that hearing aids aren't going to support background noise.
Yes. So she said that she's always been told hearing aids won't help in background noise. And a lot of it is, it's the hearing aid itself can't fix you in background noise. It's the person and what they do. So when a person has the devices, they have to use them in the background noise to hear better, if that makes sense. So a lot of times someone will come in and they're not hearing in background noise, and I'll say, well, did you go to the restaurant or the place and sit in an area that's going to be quieter for you? Did you sit in a booth in a restaurant, not in the center where it's noisy? Did you go into the room and look and see where the speakers are and position your hearing device closer to the speaker? Because the hearing device can work better in background noise, but the person themselves has to set themselves up for success. Right? So there's strategies. We were just talking about the telephone earlier and hearing on the telephone with the hearing aid. The hearing aid can't make you hear better on the telephone if you don't have the telephone positioned properly over the microphone. So the tools work when the person themselves are educated from the healthcare standpoint, the brain standpoint, and what they have to do, their behaviors to hear better. And we do see people who have hearing loss and very severe hearing loss, and they hear really, really, really successful in background noise. It's just steps taking, it's a journey. For most people, when they start having difficulties hearing, there's a 7-year gap when they receive treatment. And this poster I have here has this here, and it goes from normal up to severe. As people have more hearing loss and their brain is working harder, they put themselves at much greater risk of having memory problems and trouble hearing. And the more proactive.
Would you repeat that sentence?
So a lot of people wait 7 years to have hearing treatment. So that's like they first starting, they're having trouble with accents. They first start noticing they're having trouble in hearing a friend, or someone tells them you missed something, but they don't think they did. They wait 7 years. But in that 7 years, their hearing loss tends to get worse because hearing loss is a progressive disorder. For everybody, it gets worse over time for everybody. It's a natural part of aging. And then what happens is they're actually putting extra, it's harder on their memory because their brain is working harder to hear during that time. So what happens is we see on this graph that I have down there is that people, well, the more their hearing loss, the more they put themselves, the more their brain's working, the more they're having trouble with memory. And then on top of it, the more they're at risk of having dementia, right? They put themselves at risk. So what we try to do is we're always trying to teach people now with the hearing health, cognitive health, is that once a person starts having trouble, and it's not necessarily hearing aids, it could be brain exercises, it can be auditory games. So that's where we're moving now in hearing health and cognitive health, is that these things that people get worried about, we just brought it into our clinic in January, is auditory training games. So people can be at home on their computer on an app, and they're actually daily, they get 10 minutes a day, they can practice games, auditory, to make their brain stronger for hearing and background noise, to help prevent this from happening in the graph here. And that's independent of hearing aids. That can just be with headphones. But it's that brain training to try to get their hearing health and cognitive health stronger. Does that make sense? You know, so that's, and today the change has been, how can we better set someone else up to success themselves in background noise, not just with the device. The hearing aid is a very important part of it, but it's like trying to teach people that what they do, the brain exercises, when you're going to a restaurant, making sure that you either go during a quiet time or even in this room. There's certain areas of this room, this is a very good room, I think, to hear, but there's certain areas in this room, if it was full, that would be easier to hear in, and trying to teach people that you yourself, even if you have hearing devices, should try to sit somewhere where you hear better. And it makes a big difference when you're living with the hearing loss. And my journey has been like that. I've made every mistake in the book. I just before Christmas, I was with my sister coming through an airport, and I went to a restaurant, did not think about where we were going to sit, couldn't hear the word the waitress said. Couldn't hear my sister, and she works with me. And we didn't think about it at all. So every day intentionally thinking about, how am I going to help my brain hear better? How am I going to help myself hear better? Not, I just bought a device and it's going to do all the work for me. Because that's kind of like the shift we're trying to empower people that you can hear with hearing technology and hearing aids in background noise if you work your brain, because it is your brain that's here, it's not the ears. And once a person starts to understand that their behavior and then trying to get their brain to do better in background noise by making it easier, is a big, big, huge change for them. But does anyone have any questions about anything, like about testing or cognitive screening or
About the application of bone conductive,
for the testing or for the devices?
for both.
For both. So when someone comes in, we do test them via bone conduction. So the question was the application of bone conduction during our hearing. So when someone comes in for a hearing test, we put a bone on the back of their skull and we actually test through the bone. And that's actually how we tell if the hearing loss is like nerve damage permanent or if it's related to an ear infection. So how we tell the difference between the types of hearing losses is we put that little thing behind your ear, and that's how we're actually telling what type of hearing loss. And then for some people, which we see, it's actually amazing today, the newer technology, some people who have chronic ear infections, even to adults, we see that in generations where they didn't receive a lot of treatment when they were younger, or the shape of their ear, they can actually have a bone hearing aid. So I'll show you my cochlear implant, but it's similar design where they have something that's inserted in their ear and then they wear a piece on the top, and the bone conduction is that's how they hear. And that type of hearing loss is once that sound goes to the bone, they hear perfectly normal finally. Do you know somebody who has a bone conduction hearing aid?
No.
Okay.
I use bone conduction.
Oh, you use bone conduction, yeah. So bone conduction is amazing technology, but it's a vibration. It's for a specific type of hearing loss, though. So usually people who've had a lot of middle ear infections, so infections as children, they've had surgery on their ears, and they'll have bone conduction. My devices, my cochlear implants for my surgery are they're magnetic. So mine is I have underneath my skin, I have into my ear, I have a little electrode, and then I have a metal plate underneath my skin, and then on the side here, it's like a fridge magnet, and that's my processor, and that's how I hear through my skull. Right? And what's amazing when we talk about the brain and hearing is that when I was losing my hearing, when my hearing was going down, all they kept saying to me was, you have to constantly wear hearing aids as your hearing's going. Even when the hearing aids don't sound like they're working, because even some sound is better than no sound. And we've known that for cochlear implants since the 1970s. So as my hearing was going down, I always wore my hearing aids. My youngest sister, who doesn't live in Sarnia, she went through the same thing, but she didn't wear her hearing aids. She didn't want to wear them. She didn't like how they looked, which I get it. She didn't like wanting anyone to see them. She was, 30, 35, 40. So we both ended up getting cochlear implants. I wore mine 12 hours a day for 20 years. I was activated. I'm like the prodigy case in hearing. My speech scores are 100%. I went from having deaf speech to my hearing, my speech, everything just completely fixed. I got my cochlear implants. She didn't stimulate her brain as much with her hearing aids like the audiologist told her to. And even at the age of 40, when she got cochlear implants, she does okay, but she doesn't do like me. So the idea that your brain needs sound isn't anything new. It was just basically in 2020 that we finally had a study that showed it. And we've known that for years with cochlear implants and we see people up to the age of 95 now being implanted for cochlear implants. So hearing loss is a progressive disease. Your hearing goes down and down disorder. So most people with aging, and then some people have genetics on top of it. Some people have worked in the refineries and background noise. So on top of having aging hearing loss, they're going to have other types of hearing loss happening too, right? So they'll have more. But what we always tell people now, and I've had a few patients in their 60s, 70s, and 80s who've gotten cochlear implants, and they're doing fantastic. So when a hearing aid no longer works for them, they flip them over to a cochlear implant and they have the surgery, which is day surgery, and they do really, really well. But the whole key thing with all my patients who I've seen is that they treated their hearing loss and they wore hearing devices continuously because I used to say to them, this is long before this study, it was like, you have to stimulate your brain. Like the most best thing you'll do with aging is your diet, and there's exercise, but your brain needs to be stimulated. It needs to be stimulated by good sound. So that's kind of how things have changed in the last few years, but we've known it for years with what I had. It was always the only reason you could get a cochlear implant is if you were actually wearing a hearing aid, and then when they didn't work anymore, you had the surgery, and then you got a cochlear implant.
Nashlea, you touched on phones and you touched around crowded rooms. Can you exercise your brain for pitch? Like I can hear bird calls and I can hear James Earl Jones, for opposite ends of the spectrum. But girls age 13 to 23 to me, all sound like nasally valley girls. And it's really hard to hear them enunciate. It just all
Just
kind of
they don't hear
blends
the voice.
together. Are there exercises online for
So-
that kind of thing?
The question was, can you exercise your brain for pitch? For example, having difficulty hearing female voices or young girls' voices being nasally because of the sound. So the answer to that is yes, you can. So two things that are new now is the auditory brain training programs. They're, like I said, they're computer based. We have one in the office. It's called Amplify. Anybody, you don't have to be our patient. We've had people from Toronto who signed up. It's a 12-week online app where you have brain training games that do pitch and memory to force your brain to hear with different types of voices. And it's done on a computer, and it's 12 weeks where a person gets an outside hearing coach. And then after that, they have access to the games for years. And we recommend every 6 months going in for a week and doing like 10 minutes a day to keep your brain working. The other one that's happening in the States right now, which will be coming out very soon, and this is all related to cognitive health, this all became, because of cognitive health, these brain games were created, is piano. So there are audiologists in the States now, which eventually we will bring in, where actually patients come in and with someone hitting piano keys, they're forcing their brain to hear the different pitches and musical instruments. And they're seeing huge success in private practices like mine, having patients do that type of training. And then they put them in the sound booth and they test them hearing different voices with their hearing technology, and they're doing amazing. So we are seeing changes in how we treat hearing loss. So how we treat hearing loss now is there's a device, there's the education on what to do when you go to social situations like background noise. But the big missing piece, that's the new piece in hearing healthcare, is cognitive health, cognitive screening tied to auditory brain training. And now music therapy is the next big thing that's coming in soon, and it's new. And that's because the person has to, it's like physiotherapy for the brain. You got the devices, but have you been doing the exercises to flex those muscles? Like, have you been doing exercises to hear different pitches at home? Because just listening to voices is not going to cut it. It has to be actual training programs where you're doing 10 minutes a day, just like physiotherapy, and you're making your brain work harder to hear those pitches. And over weeks and months, just like physiotherapy, people will show improvement. And then, like I said, the music therapy is the next one that they're doing. And it's been very, very promising with people who've been doing it.
So the only thing that a hearing aid can provide you with is volume.
It's
Really, so you can get an expensive hearing aid or a less expensive one. You can get the kind that you plug in or the kind that need batteries, but all that's going to give you is volume.
It gives you, when it's done by a professional, the volume, so the frequencies. So the question was, are hearing aids basic or more expensive? Are they just all the same if I said volume? They still have to be programmed by a professional, because a person who has a hearing loss, their hearing loss is sloped across different frequencies, different pitches. So some people will have normal low pitch hearing and a lot of high pitch hearing. Some people's hearing loss goes like this, it's cookie cutter, so it's a cookie bite. So they have normal at two ends, but they dip down in the middle frequencies. So the advanced hearing technology is programmed and set for that. So if you were just to get like too much of one and too little of the other, you wouldn't be able to tolerate it. So the reason why people do better with hearing aids, what we call first fit. So now compared to 19 years ago with the newer technology, the more advanced ones, you put them on the person and most people are very happy right away with how that sounds. Right? But then that's the first step. So the first step is the hearing aid. Yes, the technology, the more expensive the hearing aid, it depends on the person's listening environment. Someone's home a lot, they're not going out a lot, they might not need the most expensive hearing aid. But if they're going to go and they're watching things online, they want Bluetooth connectivity, they're in noisy restaurants, then the more expensive hearing aids do have things in to help make it more comfortable. Again, and it also depends on the types of hearing losses. We get people in with hearing losses, certain types conductive, where yes, they need just more amplification like volume. So that's the reason why the health professional plays a crucial role. If it's not set up properly in the beginning, just like if you don't have your surgery done well, no matter what you do afterwards isn't going to work well. So the first step is having a good fit and technology that matches what you need. So that's where, like, when we do the testing, the speech and noise testing, the cognitive assessment, then we talk to the person about what they expect the hearing aid to do, and like, do you play musical instruments? Are you going to be in a lot of noisy restaurants? Do you want Bluetooth? Then you're narrowing down the manufacturer and the device based on all of those factors. And then once that's set up, then we go into the auditory training program. So it's still important, because every person, no two people have the same hearing loss. That's what's really hard. People compare. And one of my things is I've never seen two people have the same situation. It would be very easy. We would be fitting hearing aids all day long, and every person walking out the door, and they would all be happy with them if they were so easy to fit. But they're not. They're actually it's quite hard. Even the shape of a person's ear canal can match their dexterity, your vision, your dexterity, the shape of your ear canal. Some people have eczema in their ear canals, itchy ears. Every single one of those factors changes something about the device. So we have like 100 devices to pick from at this point, and we're trying to narrow it down based on everything that person told us. So it can get quite complicated. Some people super easy, and other people can be 3 and 4 and 5 different brands and different types to find what they're happy with and what meets them. So that's kind of where it's not just volume. But what I mean by volume is that it's still, you still got to work your brain. So a lot of people have bought the most expensive hearing aids and left them in the drawer. So it's 2 steps. You got to have a good device paired with good therapy and good counseling and coaching. That's the recipe for success. The device alone, for a lot of people, some people can just get a device and put it in and be perfectly happy. That's great, but that's the minority. Most people need a really good device with a good prescription. And then, because we call it a prescription, we're prescribing the device. And then therapy, coaching, and some people need actually coaching. So I use the word coaching now more than counseling, like life coaching. They need mindset coaching to get over their fears of it, and just living with the hearing aid. I've had people come in who had oxygen masks, and they've had all different disabilities going on, and all they cared about was someone seeing their hearing aids.
Thank you.
I'm sorry, I could talk forever on this topic. It's like my favorite thing to talk about.
We'll have